you, Michael. During the international health crisis of Ebola, Omaha was put on center stage for the treatment and also handling of the patients.
And many call the response a success. But what if a biological terror attack were to hit the metro? How would the response be then?
As Chase Moffitt explains, that's exactly why county health officials hosted a training response scenario today at Metro Community College.
Here's the training situation. Omaha's been the target of an anthrax attack. Public health officials, after properly diagnosing and then receiving the drugs that will cure the infected, are now tasked with distributing the pretend medication to those infected patients within 48 hours. And part of the scenario is using fruit snacks to represent the pill form of a medication they would use to help treat anthrax if this were a real situation. A little different, according to health officials, than using the needle injection they saw with H1N1.
You can get the medication for your whole family, potentially even your neighbors like that. So it's a different scenario than if we had to do an injection. We've done that in 2009 with the H1N1 situation. But a lot of the lessons you learn from these things can be transferred from one situation to another.
It's also a race against the clock. The goal is to get the medication to 639 pretend families within an hour.
We kind of played a fake patient, so it's hard to prepare as the patient or the victim, but for them it's good to see what kind of interventions or things that they can do in that situation.
Volunteer health staffers working through the kinks, hiccups, and anything that could slow the process down to help them better be prepared in case of an actual emergency.
It was really chaotic. They kind of kept changing things on us, and they had real life scenarios in case like some crazy person would come in, and so we just had to be ready for everything and know what to do in case something bad happened.
That's why they trained for the worst, just in case. Chase Moffitt, WOWT 6 News.
This was day 3 of the training after the scenarios were ran today. Officials monitoring and hosting the training debriefed the staff to figure out the successes in areas that need improvement.